I've done a lot of hackathons, and this one is really exciting simply because of the diversity of people who are in the room.
Well, it's time to get started. It's 6 o'clock on a Friday night.
We've brought together a group of strangers. This particular one brings together medical students, design students, engineers, all in one place, focused for a couple of days on really innovating in healthcare and driving patient engagement innovation.
We're trying to bring a human element to this with the focus on patient engagement. So how do we actually get human beings to interact with the technology that we want them to interact with so we can monitor their health the way that we need to help them get better?
It's really taking patient care out of the hospital or the doctor's office and giving the patient more knowledge and autonomy in their care decisions. That's really exciting to me.
So we have an army of mentors here so that every aspect of forming an idea, how you might take it to market, and has this idea already been thought of and tried before, can really come through with the different mentors that we have to help these people along.
So this is a group of strangers who've come together, and the first night was really used to gel that group of strangers into a set of teams tackling common problems.
We started off with a bit of a mixer and dinner and a keynote speech.
The shift left means with technology we can move the work that we're doing from the experts to the proletariat, right? So we take the stuff that used to have to happen at Stanford Medical School and we move it to the home, right? You can test yourself for HIV, you can do your cholesterol test, you can check your blood pressure, you can look in your kids' ears.
And after the speech, we encourage people to stand up and pitch their ideas. And it's always nerve-wracking to stand up in front of a room full of strangers and talk about your ideas.
I am interested in finding out how we can raise awareness and connect patients with financial assistance programs.
So I want my doctors to have access to my daily activities so that they can provide feedback.
I would like to work on a project where you could collect very small volumes of blood in a cheap and easy way from people at home.
On day 2, the focus is really on actually doing the brainstorming and the hacking. So how can they refine their concepts and ideas? Later this afternoon, they get to do some pitches to kind of experiment and see exactly how their ideas might come across when they go to judging tomorrow.
So in the United States, 232,000 women are diagnosed with breast cancer every year.
So we're calling this 364, and it's a service that delivers timely, personalized care for discharged patients to adapt to their new lifestyle based on data tracking.
Ultimately, at the end of the day, outcomes are transformed by changing patients' behavior. But if you can't get them to change their behavior, diseases like diabetes, congestive heart failure, those are behavior-driven diseases, particularly their progression.
So it's very exciting to be here on the third day of our hackathon and see some of the problem solutions being presented by the teams, to see who wins the first prize and begins to form, hopefully, a business around this idea or a product or solution that can go to market.
So what keeps me up at night is all the stuff that needs to get done, and the fact that doctors don't have enough time to do it.
So welcome back, everyone, and welcome to our panel of judges who are joining us for the first time today.
The last thing we do is actually hold the presentations, and then the judges select the top 3 winners.
We're tasked in this hackathon to improve patient engagement.
I get patients coming in all the time, and I really want to help them increase their medication compliance so that we can increase their health problems.
So we have a cloud-based expert system which basically determines, based on your personality, the set of things you're already going to be predisposed to for managing your health.
And we had several judges from throughout the industry, and again, through those different disciplines. I think that's really, really important in this particular hackathon, the business, the clinical, and the technical teams. And so we had judges across that spectrum looking at the different ideas.
Based on the scores alone, and there was obviously a great variety of input here, but our winner, top team here, is 364. So these are our top teams, and as I said before to some of you individually, the team at Care Innovations is really focused on helping you further your mission. So if you're not up here, and if you are up here, we're here to be a resource for you. So you've got some formal prizes here in terms of cash, in terms of access to our executives.
one of the most important things I would want to get out of this, other than some great ideas that can change healthcare and the way we monitor people in their homes, is to really bring a sense of humanness to the way we employ technology in home care. So our big hope is that people start to realize there's a person behind that technology and to focus on what their needs are and what motivates them, and then design technology from that perspective.